This is the Hope Not Note podcast,
where we answer your questions and share inspirational stories to fill your soul with hope.
Our mission is to empower hope to those who have been plagued by note.
I'm Dr. Dylan Caswell.
And I'm Brandy.
And we're here to bring you out of the note and into hope.
Welcome back to the next episode of the Hope Not Note podcast, and Happy New Year! We're so excited that you are here and thrilled that you are listening. Dylan, why don't you share your hope story for this new year? Because at the beginning of every episode, in case you're new here, we share our hope stories, inspiring things that happened over the past couple weeks or recently to us. And so, Dylan, why don't you kick us off?
I'm just in disbelief that it's already the new year. I
Yeah.
think a lot of the listeners are probably thinking the same thing. It's just, I don't know, I feel like the older that you get, the more responsibilities you have, the faster that every day goes, and then it's the week, and then the month, and then it's the year. Last year was the Jordan year. This year's the Kobe year. So I'm excited to see what 2024 brings. My hope story is really reflecting on the past year. I know each year you and I, we sit down and we think going into the new year of what is our theme or what is our word for that year. Mm-hmm. For me in 2023, that word was explode. I didn't know what that meant. Mm-hmm. I was like an explosive? Like what are we doing? Like fireworks shows? Like Hope Not Note firework display. Come check it out. And what does explode really mean? And I think a lot of people could have different definitions for it. But for me, I think it was the explode was the change. Because when something explodes, it doesn't keep the same structure that it had. So if we take the firework example, it's in this little box, you ignite it, it explodes, and then it changes into something new and something different. And I think that's what explode was for me in this past year. A lot of changes, and change is a good thing. You know, to quote Carol Dweck in her book Mindset, she says, change is the only constant. And it's so true that so many things can change in a year. I reflect back to 2020, and at that point, I didn't really, 2019 into 2020, I was like open for a relationship, but I was like, I don't know if I can be married. I'm like, I work too much and I do all these other things. And look back, I'm like, wow, like, no, you got married to the girl of your dreams, and stuff with the business and kind of going all in with our own business. There's a lot of great changes that happened. And reflecting back on the holiday season, it was our first Christmas together as a married couple that we got to celebrate. And it's exciting because we each have our own family traditions. I know for my side of the family, we go and we make a traditional, well, not traditional, Italian-American traditional homemade meal, chicken parm, eggplant parm. We cut our own pasta. And from our trip in Italy and the honeymoon, we were able to pick up some new things that we were able to make. But it's fun to be able to keep some traditions, but then start to think about the traditions that you want to start to establish with your wife in this new season while keeping some of the old ones. So, I guess my hope story is a long reflection of 2023. And I'll start off with advice of what is your theme for 2024. A lot of people sit down and they write SMART goals, which is not saying that that's a bad practice. That's a good idea. But I think a theme really helps you to stick to it, you know. And I first graduated, my theme was growth. And that allowed me to say yes to a lot of opportunities that allowed me to grow. And then the next year, the theme was different, where I then had to switch and say no to a lot of opportunities. So in each season, having that theme allows you to know, where am I putting my time and my effort into? Now, what's your hope story, Brandy?
Oh, thank you. I love that. And I think it's so important to reflect, right? Like we're right at the beginning of the new year, which is exciting. And I actually have quite a few friends who do the theme thing, and some of them, they don't get their theme until March. You know, they because they reflect and they ponder, and they don't want to just pick a random word or a random phrase. Like they really want to be intentional with it. And so sometimes they get their theme later. Sometimes they get their theme in September for the next year. And so it's funny, you know, if you're starting this new year and you want to have a theme, but nothing's, you know, speaking to you yet. One, I challenge you to make sure that you're open and you're observing, because I think that sometimes the theme's right in front of our faces. But also be patient, because it could come to you, you know, in a couple months or something of the sense. But I kind of want to stay in the theme of reflection, because when I think of, you know, my hope story, it would also be similar to just reflecting on my theme of confidence, because you said that this past year your theme was explode, and what that came with was a lot of change. And the reality is we became one, two becoming one. And so not only did you explode and have change, but I also had the opportunity to explode and have change, and I grew greatly in confidence. And I think that the more confident I became, I was able to speak to you, and you were able to grow in confidence as well. And so I'm like very thankful for the partnership that we have, because we both were able to grow in such a unique way with our themes. And I know in previous episodes I shared about, how confidence has impacted me during 2023, and it makes me excited for 2024 and what's to come, because I think that it's it's going to be special.
Yeah.
It's going to be really special.
Yeah, for sure. And I think the important point there is what you said. As you grew in confidence, you're able to speak to me. I think a lot of people that meet me or know me, they're like, well, you're a very confident person. And the reality is you can be very confident and still have self-doubts
Mm-hmm.
in what you're doing, and is it going to work, and is the mission going to reach as many people as we want it to reach.
Mm-hmm.
And so having that person there that can speak the truth to you, that is also growing. And for anyone in a relationship, you should be pushing each other to grow. You
Mm-hmm.
shouldn't just be complacent with where you're. Maybe when we're retired that will be different, but I hope it's not. I hope when we're retired, you're like, hey, what CrossFit competition are you doing this year?
Right.
And vice versa, so that we're continuously on this path of growth. Because I don't know, if you're not growing, what are you doing?
Right. Well, it's also like Ken Blanchard, who I've had the opportunity to meet a lot of times, and I consider him an expert on leadership. He says you don't retire, you refire. And so maybe when we get to retirement, we want to have more relaxing time. But I think, well, one, we're not going to retire for quite a few years.
Yeah.
But I also think, we're going to refire and have some creative thing that we're working on. Just it's in our nature to do that. And so shout out to Ken Blanchard, who reminds us not to retire, but to refire.
Yeah, absolutely.
So let's hop into the questions. If you're new here to this podcast, I know that there's often a lot of people at the beginning of the year who are searching for podcasts, searching for things to help them grow as people, as we were just talking about. And so if you're new here, we share our hope stories at the beginning, and then we dive into 3 questions that are from our viewership. And so we're so grateful because people submit those questions on our website, hopenotnope.org, and then we get to answer them. And they're anything from sports related to health, to fitness, to wellness, to goals, to perspective, insight, all the things. And so I hope that these questions encourage you and empower you today. So let's dive in. Our first question is from a listener named Nikolai, and he asks, what benefits are there for individual sports versus team sports?
Nikolai, great question. And tying it back into going into the new year, even if you are an individual athlete, you still need a team.
Mm-hmm.
It just looks a little bit different, right? So there's pros, there's cons to team versus individual athletes. I think with a team, the biggest lesson that you get, and this is coming from a football perspective, basketball perspective, even baseball, a little bit like a sacrifice bunt or something like that, that you're learning to give up your own glory to serve others on your team.
Mm-hmm.
For example, in football, I don't know if this is still legal in high school, and through some of the upper levels they got rid of it, but we used to do crack blocks.
Mm-hmm.
So if you're a wide receiver, you're out on the edge, and you're basically running a slant, except for you have no intention on catching the ball. The quarterback has no intention on throwing the ball. It's usually like a halfback toss, like out to the side, and then you're establishing the edge so the runner can get around the edge. So the corner thinks that you're running a slant, so they don't yell out to the linebacker that you're coming across, and you just blast the linebacker. And if you're a receiver and you get to blast the linebacker without them looking, it is a great feeling, but it hurts because they are a lot bigger than you. And I actually had one game where we called the crack block, and I just demolished this linebacker. I'll never forget it. I just crushed him. It was phenomenal. And the next play, the coach actually called a slant across the middle on the same side of that field. Coach, I just crush this guy without him knowing that I was coming at him. And now you're running me into him without me knowing where he's at.
Mm-hmm.
Oh, he crushed me. I got back to the huddle.
Demolished.
Everyone in the huddle, they didn't say a word. The quarterback just looked at me. This was my junior year. And he goes, "You okay?" I had snot bubbles running down my face mask. I couldn't breathe because of how hard I got hit. And I was like, no, I'm not okay. But I'm not going to lay on the field and give him that glory that he just crushed me.
Mm-hmm.
So I'm in the huddle and he's like, "Coach, send someone else in." But in those moments you go, man, I'm going to do this to serve my team.
Mm-hmm.
And with individual sports, there's still sacrifice involved, but not to that level.
Mm-hmm.
You know, in football, I love football. We have a friend that is starting to love football, and we explain the X's and O's to him because there's some plays that, why is that guy doing that?
Mm-hmm.
He's a decoy. Why is that guy doing that? Well, he's going that way because he's establishing an edge that for a play that they're eventually going to use.
Mm-hmm.
So yes, he just gave 100% effort to be a decoy for something that they're going to use in the future. And to do that, you have to be disciplined. You have to say that my team's growth is better than my individual growth or glory, that I'm willing to give up this catch or me getting the ball so that someone else can get that and achieve. Mm-hmm. And isn't that what leadership is? Mm-hmm. Isn't that what it's all about, is helping other people to grow? Like, you're growing yourself to discipline. And we had the one episode that leaders eat last, and team sports really teach you that. Mm-hmm. The other thing with team sports is that you have other people pushing you, which makes it harder for you to not give your all, which could be a pro, could be a con. Mm-hmm. Because now we go to the individual athletes. Wow, what quality do they learn by needing to push themselves
right
over and over and over again?
The same thing.
Yeah, without having that stimulus of the next guy working next to them. They're thinking of the guy they're going to be racing, or the guy they're going to be swimming against, or the person they're competing against in gymnastics, and they're, what's this person doing right now? I need to do more than them. But you don't have these people next to you that are necessarily doing that, which does make it more difficult. So I think as an individual athlete, you also need to be disciplined. You need to be disciplined in your work ethic to keep pushing and keep pushing. Same time we mentioned earlier, individual athletes never do it on their own. Yeah. They always have a coach, a team, someone that's helping them to get there. But I think they need to work harder for community within that sport, right? Because like, I know growing up I wrestled, and I wrestled till 9th grade, and then I was a little burnt out from it. And we had a great community of wrestlers, but there was the reality that I had to go against some of my best friends for first and second place. Mm-hmm. So now this person that is your friend, you're now competing against. That doesn't really happen too much in team sports. Like, you compete for a position, but you're not competing for each other to stand on a podium. Right. So as much as like individual athletes have, like, the wrestling team is there, like, you can still be going against that guy in a competition. So the dynamic is a little bit harder. I think as an individual athlete, you have to fight harder for true community. But also, you know, we were watching this the other day, but I know one of my friends, him and we were in the same weight class, and he was a much better wrestler than I was. I could hang with him, but he wrestled in college. He's phenomenal. And I remember the first time I wrestled him, I was almost like, all right, how are we going to handle this? Like, we throwing down, like, we going at it like we do in practice. Like, how do we want to go at this? And he came out and he put a deep double leg on me and slammed me onto the mat. And I was like, okay, like, this is it. Right. It's game on. But now I look back, I'm like, wow, I'm so thankful for that. Because what do true friends do? I'm not handing you this victory. If you want this, come and take it from me. Get better. Get mad. Go back and practice harder so that one day you can try to beat me. Never beat him. Yeah. Took him down a few times. Never beat him. But it pushed me to try to find the best potential, or to reach the potential that he saw in me. Because if he came at me soft, then I would start to question, well, am I a soft wrestler? But because he came at me so hard, I'm like, whoa, you respect me as a wrestler, so you're coming at me.
Yeah. Oh, I love that. I think of CrossFit too, right? Like, we typically work out here in our gym, in our private garage, where we have each other, and there are times where we compete against each other, and CrossFit has the opportunity for you to be both individual or team at certain competitions, but most of the time it's more of like an individualized sport. But you typically, if you're in a class, you have 5, 10, 15, 20, 30, if not more, depending on the size of the gym, people there that I know for us, when we drop in at places, it gives us a little bit extra competition.
Yeah.
Because instead of competing against ourselves or competing against each other, which is hard to say that we're competing against each other, instead you drop into a class and I look at a girl, I kind of size her up, or you do the same, and it's like, okay, I'm gonna push myself today. I'm gonna like compare to this person, and not in a bad way, but just to kind of like push a little more. And I think of the benefits of that, but I also think of, like you said at the beginning, like when we work out and do this sport by ourselves, it's creating a different sort of discipline versus going to the gym. But I don't I don't know, Nikolai, I don't think that you're suggesting this, but I don't think there's better, like individual sports are not better than team sports and vice versa. I think it's preference. I think it's season of life. I think it's resources. But at the end of the day, if you're a team sport or an individual sport, you need people around you supporting you. I recently saw, I think it was this past fall, there was somebody who I think it was from Kenya. Do you remember the person that completed the marathon in like
Oh,
2 hours?
Yeah, the mile split time was like 4:16 for the marathon. Like,
Absolutely,
what?
absolutely insane. And you think marathon, okay, that's an individualized sport, right? But the first thing that this person did was, what I'm assuming, jump into the arms of their coach, right, or a family member. But I'm assuming it was their coach, and I was just like, yes, like
Yeah.
that's what it's about. Not only like he didn't accomplish this great, unspeakable, like unheard of thing without the support of other people.
Yeah, and to that point, there's a lot of commonality between these two things. I think if you're a team sport athlete, you have to work harder on the individuality of that position, right? I was describing that example in football. I'm sacrificing for one of your brothers on the field, but at the same time, as a athlete that wanted to improve, I had to work hard at my discipline of being a receiver. That a lineman wanted to do, but that wasn't their role, right? Their role is, how quick can I accelerate out of my stance and create contact? Or mine is, how quick can I get to open space to give my quarterback a target? So we each have these individual things that we need to work upon. So then as an individual athlete, you're working harder to establish a team. But I think the last thing I'd want to say in this discussion is that I think everyone should experience team athletics or team sports or communities. I think everyone should have individual training because they're so different from each other. When you're in a community throwing down in a workout, you don't necessarily have the demons that come up in your brain. Because if they do, you look over and see, whoa, there's a 70-year-old over there doing kettlebell swings. What the heck am I complaining about? And it motivates you to keep going, which is the beauty of having people. When you're on your own and you're in a garage and you write this workout and you get 25% of the way through it and you just get punched in the mouth, and you know that I could stop this workout right now and nobody would know. Nobody would ever find out about this. I can just wipe it off the whiteboard, not put it in the workout journal. My wife doesn't even need to know that I stopped this workout, but you'd be able to tell, because I'd come in super disappointed and I'd be mad at myself because we have a rule. If it's on the whiteboard, you have to complete it. That you have to do it. So when you're working out individually, and not just for us CrossFit, but for other athletes, like you're working on wide receiver drills by yourself. You're working on, shuffling in lacrosse by yourself. You're working on skating by yourself. You're working on running by yourself. I think that's when you really find out what you're made of. That's when you really find out, what is my strongest thought? Because when it comes up, there's no one saying to you in that moment, you got this, keep going. It's you. It's you versus you. So you have to take that thought and decide, what am I going to do with it? And we know when we drop into classes, you can be on the bike and a coach comes by and they go, all right, you got this. And you're like, I do got this. And you start pedaling a little bit harder. When you're by yourself, you go, oh, I'm really tired.
I'm gonna die.
My legs are blowing up.
Yeah.
Why did I program this workout? Oh, I'm not strong enough for this workout. I don't have enough conditioning for this workout. I don't have enough resources to be doing this sport. I don't have enough resources to do a business. I don't have enough resources to be a good husband. You get in this crazy thought train that you then have to be responsible for of shutting down, which teaches you, which we talk in the book a lot about, is that ability to respond versus react. And I think that is beneficial for everybody. It definitely takes steps to get there, but it is. I remember the first time I completely worked out on my own, no one else around, and it was so different. And I was just, I was in disbelief of the thoughts that came up during it.
Yeah, it builds character.
Yeah.
I both do, but I think individual sports, working out by yourself, it builds a certain type of character that I think is more needed in the world, you know,
Right.
in a lot of ways. But we could talk for a long time about sports, but for the sake of time, let's hop into a new question.
Sounds good.
This next question is from a listener named Matthew, and he asks, I'm a PT student and have learned all these special tests, but not really sure how to use them clinically. Any advice?
Matthew, great question. If I could change the name of these tests, I would change it to something else other than special tests.
Not so special
because
tests.
they're really not so special. I think they used to be special, but as research has evolved, we're learning that they're really not as special as we once thought that they were. So the reason that they're called special tests is the thought is that if we do this clinical test, it then will give us this diagnosis that tells us that this is what's happening. And then if we can say that this is what's happening, then we can form the solution, the treatment around this thing that is happening. I can give perspective from being a student and learning all of these special tests and going through and getting my board specialization in sports and learning all the clinical test batteries. I can give perspective from being a professor that had to teach all these special tests. I can give perspective as now being a mentor to mentees of practicing PTs of how do we use these special tests. It's a very dynamic discussion, and I'm trying to figure out how to limit it down.
Channel it.
So I'm going to do my best here to talk to the PT students, the PTs, the healthcare providers, but then also to the general population, in which Brandy can help me out with that. So special tests, all of these were made, and they tend to come from more of an orthopedic population. Again, that if we do this test, it says that this is a thing that's happening. For a test to be special, it has to be compared to a gold standard. And then from that gold standard, we start to get test properties of validity. The higher validity that you have means that this test is a valid test to show that this is the actual diagnosis that is happening. Let me run through an example here. Let's say we're trying to diagnose someone with a rotator cuff related shoulder pain or shoulder pain. And we're trying to say it's the supraspinatus tendon. Like we're trying to get specific. Supraspinatus tendon. The gold standard to this would be doing imaging. And the image shows that the tendon is abnormal. So that is the gold standard. I don't agree with that gold standard, but that's the gold standard to date. So then this test is developed to say, if we do this test and it's positive, how much does it match up to what the gold standard was, which is the image in this case? And then how much likelihood do we put into this that it's the true cause of what's happening and not other factors? So now we're getting into likelihood ratios, which there's a lot of statistics in it that can get confusing. So the test for supraspinatus tendon is that you lift your arm up, you turn your thumb down, you can hold it there, someone gives you pressure, or you can just lift it through that range. And if that's positive, then all right, you must have a supraspinatus tendon pathology, which is part of the rotator cuff. So let me back up and show why that's not a good special test. Our gold standards are now more like bronze standards, or I don't know the other models. There's no model for fourth, fifth, sixth, but very much less than a gold standard. The reason being is because when imaging was done on asymptomatic populations, and this was in 91% of the population, abnormalities were shown on the rotator cuff, and they had no pain and no symptoms whatsoever. So now that our comparison to the gold standard has changed. So now with this test, of lifting your arm up, how can we say that that's due to your supraspinatus tendon being pathological? Because even when you do that test, there's nearly 9 other muscles that are equally active. So now this test that's saying that this is happening isn't valid. The likelihood ratio goes down. So I asked, what's the point of doing it? Like, why do we use these things? In students, for the shoulder alone, there's over 70 special tests that are taught and that they're responsible for knowing and regurgitating on an exam and showing that they can actually do this test out in practice. So there's a lot of growth that needs to happen in that system. So now let me back up, because that's the case of why special tests don't really need to be used, because they're not giving us the data that we thought that it would be giving. When a special test is appropriate is when it does have good test properties, and it's for something that we're trying to decide, should they be referred, right? So if someone fractures their leg, it's probably good to use a special test to say, yeah, this is fractured, you should go to the hospital. Someone comes in, they're a younger athlete, they have a full rotator cuff tear, you lift their arm up and it drops down to the side. Good time to have a special test to say, yeah, it's high likelihood that you have a full rotator cuff tear, and that because you are young and active, we may want to proceed with other interventions. So let me do this test, that's positive. Okay, we should refer you to other care, but we can continue to start with our care to bring down your symptoms. So there is a time and place for these special tests, but they tend to be in these direct access situations when we're trying to figure out where the person should be directed. Are they appropriate to be in physical therapy? Do they need to go see an orthopedist? And you have to be able to determine that. So now, from my sports specialization, we learned that we should put these clinical tests together into a battery of tests. And that if we use a battery of tests together, then we can be a little bit more certain that this is actually the thing that's creating the symptoms. And to quote a mentor in the field, if you have one pile of dog poo and you put it together with another pile of dog poo, what do you have? A bigger pile of dog poo.
Yep.
So I think we started to be a little bit on the right track of, well, if we combine these tests together, they're more powerful. But the bigger issue is that the gold standard is not the gold standard. So now we're still comparing it to this thing that doesn't really, it's not explaining why they have symptoms. It's not explaining why they have pain. So we can't put all of our time and effort and credibility and diagnoses into these special tests. Oftentimes, and what we're seeing is that diagnoses are becoming more broad, which they should be, because pain is very complex, that we can't say that your shoulder pain is due to a supraspinatus tendon. It may play a part, but so does your sleep. So does your fulfillment. So does your gratitude practice. So does your nutrition. So does all these other things that make you a human. That plays a role in this shoulder pain. So what I will tend to tell people is we'll go through, we do objective tests that have numbers on it and show them that, hey, we tested your conditioning of your shoulder and you hit 15 newtons of force with your external rotation. Internal rotation, you hit 20 newtons of force. That's good. That's a good ratio. On this side, you had 10 newtons and then 20 newtons. That's 50%. We want to increase that to 66 to 75%. Like, that's a good ratio for your ER to IR to be at. Well, now we have something to work towards. Is it explaining why they have their symptoms? No. Is it a piece of the puzzle? Absolutely. But there's all these other pieces that we mentioned earlier that play a role into that. So wrapping that long segment up, the biggest advice I have for you, Matthew, is that the greatest thing that you can do as a clinician and as a provider is to listen to your patient. This is the biggest change I've made in my practice. I came out of school, I had all these special tests, like 70 for the shoulder. I can tell you that's your supraspinatus versus your teres minor. I can tell you that it's this. I can tell you, no, you can't. The tests do not allow you to do that. But that, I was like, this is what we should do, because then I get more info, and if I have more info, then I can treat better. Well, what I learned is that the more that you listen to your patient in the subjective part of your examination, and you use true active listening, and you're there with them and they open up and share their story with you, by the end of that conversation, you're going to have a really good idea of where you need to go.
Mm-hmm.
You might use screening, you might use a couple objective tests, you might use some tests to rule a couple things out, but it really limits it down. And I will say, don't use a special test just because you think you need to use a special test because you learned it in school. If you're using a special test, you should know why you're using it. And to that point, any movement that you're giving out, any modality that you're using, any rep scheme that you're using, there should be intention behind it.
Mm-hmm.
Why am I using this? Why am I doing this? And then I'll say too, we do offer mentoring to clinicians, and it's something that I really enjoy because they have a good fundamental base, but they're eager to learn more and to get a little bit more up to date. And how do I spent 7 to 8 years in school learning these tests, and you're telling me that I just shouldn't use them all. Well, then what should I be using? And there's a whole framework, there's a whole system that we use to really help. Is this external load? Is it internal load? Is it a combination of both? And what puzzle pieces, what levers do we need to pull? What outside help do we need to get this person to where they want to go to? Anything you would add
That's
into
awesome.
that long
No, that's
discussion?
awesome.
I hope it painted the picture and didn't confuse people or lose people in it.
No, I thought it was perfect. I think too, for our listeners who may not be PT students or, in the field in general, the last point that you made was very simple, but there could be a combination of external and internal load that people are going through. And I know for me, I had an injury, in high school, that external load, right? But there was a lot of internal load going on, but I was immature, didn't really understand what internal load was and all the things. And so my doctors probably did a bunch, I don't even remember, but they would have done a bunch of special tests. I never felt listened to by any of the doctors, but I look back and I'm like, man, if one of those doctors would have just realized the fear that I had, because I think the biggest thing was I was afraid that I wouldn't be able to play sports again. I was afraid that I'd be out and lose an opportunity for a scholarship, all these things, which ended up being the case. I ended up being injured for a very, very long time, wasn't able to go to college for sports. And like the thing that I loved the most in the world at the time was sports, and I lost it all. But none of the doctors like acknowledged that internal load. And so for someone who's listening who may not be in the field, but may know people who have pain or go through injuries, realizing that sometimes it's only internal load, but usually if there is external load, there's internal load as well. Like there's always going to be internal load, right?
Yeah.
And then there's often external load, but I really believe you can't have external load without some sort of internal load happening.
Yeah, and I kind of chuckle at some of the posts you see on social media. This exercise will fix your back pain. This one exercise is going to solve your back pain. It may help. It may be part of the puzzle.
But growing in peace and gratitude.
Growing in peace and gratitude. And asking the question, well, what really brought on that back pain? And is doing a cat camel going to be the thing that really solves your back pain long term? Probably not. It might be a good symptom modulator,
right,
to then allow you to get out of that space of very high level pain, where then you can reflect a little bit more and retrospectively look back and go, wow, my habits and my patterns and my behaviors, and I was in a toxic work environment, a relationship, whatever it may be. I've never worked with an athlete that had an injury, that had the injury at the time in their life that they were at their peak and doing great and didn't have high internal load.
Right.
And the data is starting to show this. The clinical practice guidelines are starting to ask more questions of this psychosocial model and how it's related to tendon pain. We see it all the time in our youth athletes. And I'm really starting to wonder, like, it was called the biopsychosocial model. And I'm wondering how long the bio stays. And it used to be like capital and first. And I'm almost like, I wonder if it should be psychosocial bio.
Yeah.
Because we know that the emotional component and those factors play a much bigger role
Yeah.
in the pain response than biomechanics do. And there's a ton of data on biomechanics. We used to think that dynamic knee valgus was the cause of ACL injuries and ACL tears. Now we're learning that that position happens after the ACL has already torn. And it's already torn because the feed forward mechanism has failed. How's the feed forward mechanism failed? Well, because something in their brain is fearful and not getting the message to the movement system.
Right.
So now we almost have to go back and go, oh, maybe we don't need to do 30 clamshells as part of a prevention program. Maybe we just need to ask our athletes, how are you doing? You doing all right? Like, really, are you okay?
Right.
Like, I work with an athlete now that has so much on his schedule
Yeah.
that sometimes our sessions are taking 5 minutes to just chat and just talk.
Need to like debrief.
Yeah, how's your fantasy football team going? Who are you getting in free agency? What trades you making?
Yeah.
Like, whoa. Oh yeah, I get to talk. I get to sit down a little bit and like have some time. And it's so important for all youth athletes, for lifelong athletes, which is everybody that's listening to this podcast and everyone in the future that will be listening to this podcast. If you're thinking that I am not an athlete, I'm not a lifelong athlete, you are. You just don't know it yet.
Yeah. Perfect. I agree. Our last question is from a listener named Janice, and she asks, how does achieving your goals benefit other areas of your life? And I think this is a perfect question since it's the new year and a lot of people are, setting goals and everything. So what are your thoughts?
Janice, I'm going to try to simplify my answer and not go off on a rant. Maybe that's my theme of 2024.
Rant.
Just rants. No, just kidding. We won't do that. But
your soapbox.
I think the biggest thing that happens when you achieve a goal is you give yourself evidence that you're capable of doing it, which then cascades into the next goal, which then cascades into the next goal. I've worked with a lot of people that have had a simple goal. I want to walk without low back pain. A year later, they're running the mountain goat. Remember when you wanted to just walk without low back pain and you just ran the hilliest race in our community and you did that without back pain? Yeah. I'm training for a triathlon now. What? This person that said that I just want to walk without back pain, you're now training for a triathlon? Whoa. But it's building momentum. And that's something that we've been doing in our meetings week by week, is talking about momentum and how do we build it and how is this activated? And I think it is achieving that goal. Did you achieve it? You get to the peak and then you just go, I kind of like that process. What's the next one? And then you do it and then you reach something that you thought was unattainable. Well, if I can do that, maybe this other thing is achievable. And I think that you just keep going. And the goals, they change. They might become a little bit more complex. They definitely get you closer to what your true dream is. That dream that you had that thought was like so unachievable that no, you can actually reach it, but it's one step at a time.
Yeah. We talk often about hope and how hope is not this passive thing. And I think that dreams are also not this passive thing. Dreams happen when you put in the work. And I think of, in a new year, you want to be disciplined. You want to achieve all of these great goals, all these things. And a couple years back, I had this goal of reading. I like reading, but I don't discipline myself to read, right? And I had this goal of reading like 12 books in the year. And halfway through the year, I wasn't even at 6. And I was like, oh my gosh, how am I going to do this? And then I simply just said, the goal wasn't to read 12 books in order to read 12 books. The goal was to read 12 books to discipline myself to read more on a regular basis. And so, no, I did not achieve that goal of 12 books, but I read not every day, but like at least a few hours a week, which the year prior I would read like maybe once a month.
Yeah.
And so it's also having like an open mind of, what are these goals, and am I being so obsessed with them that it's negatively affecting other areas of my life? Or can I be open-minded? can I have small goals that I can be honest with myself about the small goals, and then those small honest goals can build momentum, as you said.
Yeah, and to dive into momentum just a little bit, because it's something that we've been studying, and got this from Craig Rochelle, who is an amazing leader, and his mission is inspiring other leaders, and everything he does is to allow people to become better leaders, because as he says, everybody wins when the leader gets better.
Yeah.
Momentum. It is, let me see if I can do it. There's 4 steps to it. Let's go for it. In my brain, I was like, don't do it. And then we're like, all right, no, we're going to go for it. So let's see. So it's activated by vision, inspired by faith, supported by systems, and sustained by grit.
Mm-hmm.
So those 4 things. I think in combination with hope, the biggest thing is supported by systems, sustained by grit.
Mm-hmm.
You have to work for it, and you have to have a system. To that point, to achieve your goal this year, we get to a new year, people make New Year's resolutions, and they make it for, by the end of 2024, I will achieve this thing. How about for the month of January, I am going to do this to change my habit and change my behavior and my pattern to make that sustainable, so that by the end of the year, I've achieved this thing. Make it even simpler. Today, I'm going to wake up in the morning and I'm going to make my bed. I'm going to wake up in the morning, and before grabbing my phone, I'm going to get out of bed, go see sunlight. If you're in the Northeast, it's very cold and you have to bundle up, but there's a lot of benefits to it. Before grabbing my phone, I'm going to start reading. Before grabbing my phone, I'm going to go outside and go for a walk. But pick these simple things that you can achieve day after day after day, because the thing that fuels momentum is simplicity. The thing that will crush momentum is complexity. And if your goal is to lose 20 pounds by the end of the year, that is a complex goal, because there's a lot that goes into how that weight came on. And there's a lot to dissect in that goal. That is a big, complex goal that just going to work out for a month on a 30-day challenge is not going to get you there. It might give you a little taste of it, but it's not going to be a sustainable system. So we have to start simple. So start simple, build that momentum by achieving that goal, and then let that momentum snowball just continue to roll and get bigger and bigger and bigger.
It's the 1% better every day.
1% better every day.
Yeah. Awesome. Well, Janice, we hope that whatever goals you're setting for this new year, that it does empower other areas of your life, and it does bless other areas of your life. And you didn't ask the question, how does achieving your goals affect? You said, how does it benefit? So she already knows that it's a benefit when you set a goal, when you achieve goal, when you have simple goals that you can hit on a regular basis, it benefits all the other areas of your life, at least the other areas that are virtuous, right? And so, Janice, thank you for that question, because I think that it'll bless a lot of the people and empower a lot of the people who are listening in this new year. And our mission is to empower hope to those plagued by nope. And you've faced nope. We've all faced nope, whether it's suffering or rejection or anything. There's so many different examples of nope out there. You have the opportunity to be empowered by hope, and a big thanks to Janice for giving us the opportunity to do that on this podcast. If you're interested in asking a question, if one of these questions inspired you and got you thinking, and you're like, oh, I have a question, head over to our website, hopenotnope.org, and you can ask us a question, and it will be featured on future podcasts. And please share this with a friend or a family member or someone else. Maybe in this new year, you have an accountability partner. Share this with them, because I think that getting started off on a new year, this podcast can really help a lot of people, because it is very versatile. There are a lot of different themes and questions that we answer, and it can really help you in the long term. And so please share, like, subscribe. We're so grateful to be here and to utilize this content to serve you better. 2024, reflect on your theme, pick your theme, get after, let your values be the guardrail, and put the work in. Like, hope is not passive, it's learned and it's earned. So you're learning by joining us on this episode, by our other content, whether it's YouTube or grabbing a copy of the book.
and then it's on you to go earn it. Like you got to put the steps in, you got to put the work in, whether it's individual or a team, but it's always a team. And we're happy to be part of your team, both people listening that are close in our community, people that are overseas. You are part of our community, and we are just so thankful to have you join us. Have a great week. I was gonna say have a great year, but we have other podcasts coming out this year, so we'll stick with a week. Have a great week, and remember, every day is not just a day to be hopeful. It's an opportunity to become hope.